Yes, I'm here.
I'm very happy to have our upcoming webinar, which is going to be presented on energy alterations and chakras, energy deficiencies and propensity to coronavirus infection. And this webinar is being conducted from Enliven Archive on behalf of this pandemic situation. And we are very glad to have Dr. Huang on online to deliver her lecture. Before starting our webinar, I'll have a very brief introduction of Dr. Huang Wei Ling. Dr. Huang Wei Ling is born in Taiwan and raised and graduated in medicine in Brazil. She is specialist in infectious and parasitic diseases, a general practitioner and parenteral and internal medical nutrition therapist. Once in charge of the Hospital Infection Control Service of the City of Franca's General Hospital, she was responsible for the control of all prescribed antimicrobial medication and received an award for the best paper presented at the Brazilian Hospital Infection Control Congress in 1998. Since 1997, she worked with the approach and treatment of all chronic diseases in a holistic way, with treatment guided through the teachings of traditional Chinese medicine and Hippocrates. She is a researcher in the University of Sao Paulo in the ophthalmology department from 2012 to 2013, and she is being treating a lot of patients with a lot of many problems in all areas. It might be a cancer, or it might be a physical treatment, or it might be any sort of problem. She is being treated with the help of energy circles and chakras. We are very happy to have her for delivering her speech on this particular webinar. And her perspective of looking into the problem in different way actually made her unique in the field. Thanks a lot, and we welcome you to the talk. You can go ahead with the talk, Dr. Huang.
Thank you, Kumar, for the introduction. Good morning to everyone. My name is Huang Weilin. I am a medical doctor from Brazil. It has been 28 years since my medical school graduation, and I have 6 specialties, the first being infectious disease, though for the last 23 years I have been working with medical acupuncture and traditional Chinese medicine in my own clinic in Brazil. I have been working in worldwide medical conferences, all emphasizing to treat the patient as a whole in the energy point of view and not only the patient's symptoms. Today, I will present a study entitled Energy Alterations and Chakras Energy Deficiencies and Propensity to Coronavirus Infection. This presentation is a little extensive and will be divided in 3 parts. The first is an introduction of the concepts of traditional Chinese medicine for those that are not used to it. The second demonstrates a study of mine studying the chakras energy alterations on the patients of my clinic in Franca, São Paulo, Brazil. And the third part analyzes the 3 phases of the coronavirus infection and how these patients analyzed would react to the pandemic on the energy level. I will also explain the possible complications associated with these patients according to their energy imbalances and the reaction of the patients to the treatment proposed nowadays. Coronavirus is a novel viral infection which first appeared in Wuhan, China on November and December 2019. Today is May 28th, and the numbers keeping changing. Today, there was almost 5,700,000 people infected by the virus and more than 100,000 deaths until today. Several studies have been developed with the aim of better comprehend, prevent, and treat coronavirus infection. However, the majority of these studies are focused on the pathogen SARS-CoV-2. This study was based on the thoughts of Hippocrates, which are: it is more important to know what sort of a person has a disease than what sort of disease a person has. In other of his quotes, he also said that it is extremely important to consider other scientific gains and traditions within medicine prior to the knowledge we have nowadays. For this reason, this study I'm exposing today will emphasize the type of person we have nowadays and use the knowledge of ancient medical traditions such as traditional Chinese medicine and Ayurvedic medicine knowledge to try to explain the process of coronavirus on the energy point of view and why the disease achieved such extreme levels nowadays, as well as the influence of the treatment recommended on the outcome of the patient. The concept of health and well-being in traditional Chinese medicine is mainly associated with the balance of yin and yang. For yin and yang to flow in the energy meridians, two other energies have to work with harmony with it. It's qi and blood. To achieve health, the main aim is to balance these four forces, energy, yin, yang, qi, and blood, and as demonstrated on this slide. Each patient has to be analyzed individually according to their energy imbalance. The lack of energy of one of these energies or a combination of them can lead to the formation of internal heat inside the body, as you can see on this slide. When a patient that already has energy imbalances and energy deficiencies of yin, yang, qi, and blood acquires coronavirus, they will tend to have a more severe inflammatory process, as internal heat may be comprehended as inflammation in Western medicine. To diagnose the energy imbalances of the patient, a series of questions are used. If the patient does not have daily bowel movement, this may mean that the patient has blood deficiency. If the patient has excessive sweating during the day, this may be a symptom of qi deficiency. If the patient feels colder on the extremities of the body with cold feet or hands, this may be related to yang deficiency. On the other hand, when the patient feels hotter on the extremities of the body, this may be a sign of qi deficiency. And if the patient has dry mouth, bad breath, bleeding gums, acne or redness in the skin, abdominal pain, microhematuria, or itching, this may be a sign of heat retention. As these concepts may be hard to conceptualize for a Western medicine physician, I use the metaphor of the tree to facilitate the comprehension. On this slide, you can see the tree-like figure. The tree has a trunk with several branches. Each branch represents one medical specialty, and each leaf coming out from each branch represents the symptoms and disease of each specialty. The leaves and the branches are the visible part and the object of study and practice in Western medical profession because of the curriculum offered in the medical schools around the world. Coronavirus infection presents symptoms on the most variety specialties. It can appear as flu, fever, cough, shortness of breath, abdominal pain, diarrhea, dermatitis, encephalitis, renal insufficiency, conjunctivitis, anosmia, disseminated intravascular coagulation, respiratory insufficiency, etc. All these symptoms are on the leaf level of the metaphor of the tree. In Western medicine, each of these symptoms are treated by different medical specialties represented by branches on the tree metaphor. What will be emphasized today aims to explain what is below the earth, the energy imbalances on the root of the tree invisible to the naked eye. Traditional Chinese medicine studies these energies and is what we will analyze today. There is a flow of energy going from the root to the leaves. It represents the nutritional center of the body, and the energy will flow through the energy meridians, taking energy from the root to the leaf, and from the leaves to the root. All the symptoms of the body in traditional Chinese medicine are interconnected systems. All the systems of the body in traditional Chinese medicine are interconnected, as well as all the internal organs. When the root is imbalanced or damaged, symptoms will appear on the leaves. On today's presentation, I will demonstrate that the patients before the coronavirus infection already have damage on the root of the problem, leading to a propensity to an infection and complications, especially with the treatment proposed nowadays, and what we can do to minimize these complications, knowing these patients already have an energy imbalance. Everything in the world is formed by energy, including the human body. What we can see with the naked eye, system, and organs is materialized energy, and what is on the root of the tree is not materialized energy. That is yin, yang, qi, and blood energies. In my presentation today, I will focus on the root level and on the external pathogenic factors not visible by naked eye. In traditional Chinese medicine reasoning, when knowing the mechanism and the way the disease occurs, considering the external pathogenic factors and the root, it is possible to treat any disease using the same method, maintaining the balance of yin, yang, qi, and blood. The roots of the tree represent the theory of the five elements and yin and yang. Yin and yang are two opposite and complementary forces that exist in our world in everything, including the human body. A possible example is day and night, man and woman, good and bad. Traditional Chinese medicine used the balance of these two energies as the main cornerstone for the treatment of all sorts of symptoms and disease. And the balance of yin and yang determines health in TCM. Another theory on the root of the tree is the five elements theory, which explains the functioning of nature and the interconnection between the massive organs inside the body. In this theory, all organs are interconnected, and everything that happens with an organ on the energy will influence the other organs and the whole system. This is very important to understand regarding the symptoms and complications of coronavirus infection and the treatment done nowadays, because in Western medicine, the symptoms are treated separately, while in TCM, they all come from the same root. On the theory of five elements, the elements are fire, earth, metal, water, and wood, and are represented by the five massive organs, which are heart, spleen, lungs, kidney, and liver, respectively. Each element provides the energy for the formation and the maintenance of the next element, as you can see on this slide. This process is entitled generation cycle. And in the five element theory, each organ is responsible for the functioning of an external sensorial organ. One example is metal element. Here, metal element represented by the lung, responsible for the sense of smell. The lack of energy in this meridian can lead to symptoms of anosmia, which is sometimes is associated with coronavirus infected patients. Another example is the earth element, represented by the spleen that is responsible for the sense of taste, and the lack of energy in the spleen can lead to difficulty in feeling taste, also very seen in patients with coronavirus infection. And in five-element theory, when talking about one element, I will know the orientation, the season, the climate, the cultivation, in organ, young organ, orifice, tissue, emotions, color, taste, and voice. The table on this slide shows the resonance of the five elements in all parts of the body, but we can analyze it more carefully after the presentation if you wish. This image you can see represents the chakras energy center on Ayurvedic medicine. And the superior is the seventh chakra, and the inferior is the first. As there are 7 chakras and 5 elements, this means that the chakras 1 to 5 represent the 5 massive organs in traditional Chinese medicine, and the 7 corresponds to the first chakra, and the 6 corresponds to the second chakra. Each chakra is responsible for several functions, working as the reserve of energy of each organ that is responsible for. Therefore, the level of energy on the root level is associated with the level of energy on the chakras, as you can see on this slide. With the use of this tool, it is possible to explain the concept of energy in traditional Chinese medicine to the Western medicine physician to understand what I want to explain. It is also a tool to demonstrate the result of the measurement, as the energy measurement vary among different doctors, as the measurement is usually done analyzing the arterial pulse of the patient in TCM. In this study, the radiesthesia was used to measure the level of the chakras energy of the analyzed patient, therefore measuring the barriers of the patient on the energy level. To measure the energy of the chakras, I use the procedure called the radiesthesia. The procedure of radiesthesia is done using a crystal pendulum, and this pendulum is placed in front of each person's chakra. The pendulum may stay still or move clockwise or counterclockwise. These movements are classified in a scale 1 to 8, 1 being the minimum level of energy and 8 the normal level. If the pendulum does not move, the patient has no energy on the evaluated chakra. If it moves clockwise, it will be classified from 1 to 8 according to the intensity of the movement. And when the movement is counterclockwise, maybe external interference, and it has to be studied individually. With the main goal of showing the type of patients we have instead of analyze the pathogen, as recommended by Hippocrates. Usually, I describe the energy imbalances of each patient instead of using only the Western diagnosis, because the same diagnosis in Western medicine can be caused by different energy imbalances. And I believe the same logic can be applied for coronavirus infection patients. On the beginning of coronavirus outbreak in China, it was emphasized that elderly, diabetic patients, cancer patients, obese, pulmonary, or patients with cardiovascular disease are more prompt to be infected. Within the months, it was possible to notice that not only these patients were infected or had to be hospitalized due to the disease or die. Now we'll expose the results of this study I developed, which is the reason of the presentation today. I started to measure the energy of the patient in 2015, and I'm still doing it right now in 2020. In this period, I measured the chakras energy of among 1,000 patients, but I was only able to analyze and compile the files of 409 patients, taking the initials of the patient, the dates of the measurement of the chakras energy, the diagnosis in Western and in traditional Chinese medicine, and the age of the patients vary among 2 to 70 years old patients. And the next slide will show the results. The first graph shows one of the most important information of this study. The patients were divided in two groups, table 3 and table 4. The table 3, representing almost 69% of the patients studied, had the same result, showing that they had no energy from chakras 1 to 6. This group, they are divided from child to the elderly, from 0 to 9, 10 to 19, 20 to 29, 30 to 30, until 80 to 89 years. And they have no energy in any chakra from 1 to 6. They only, in this group, they only have energy on the 7th chakra, that is the spiritual chakra, but the chakra representing the liver, kidney, and the heart, lung, spleen, lung, heart. It's the spleen, lung, heart, kidney, and liver. They all these organs don't have energy in all ages. Only the spiritual chakra has energy. And in this table represents the 20% of the study. They are divided in the same ages, but the difference is that in this group, the 7th chakra don't have energy too. And all these chakras, they don't have energy from 1 to 7. They don't have any chakra. And they correspond to almost 90% of the study, in this study. What this represents on the functioning of the human body, if each chakra corresponds to the functioning of one of the massive organs, if each massive organ is responsible for the functioning of other external sensorial organs and production of yin and qi blood, this means that almost 90% of the group I studied is on the inferior limit of energy, working with the reserve of energy, explain the majority of the chronic disease, increasing of risk of cancer, diabetes, depression, anxiety, panic syndrome, dermatitis, infertility, etc. As published in several studies of mine, correlating the lack of energy of the chakras with this disease, including children. Getting into coronavirus infection, how a population with this level of energy deficiency will react to the virus infection and the treatment they are receiving, what will happen? This question will be answered within this presentation. This graphic shows the total of patients according to the traditional Chinese medicine diagnosis. 36% of the patients had deficiency of yin, 90% have internal heat, and 19% had deficiency of yang, and 40% had deficiency of blood, and 10% had the deficiency of Qi. As the majority of patients have energy deficiency, leading to the formation of internal heat, the patient already has an inflammatory process happening before acquiring coronavirus. With the internalization of the external pathogenic factors, more internal heat is formed. If the patient is hospitalized using high concentrated medications, this will drop even more the vital energy that is already low, formating more internal heat as well, which will manifest as alteration of inflammation on the laboratory exams seen on the evolution of coronavirus infection. In this slide, it is possible to see the more common pathologies and diagnoses among the patient studies. The first is anxiety, the second is headache, the third is low back pain, the fourth is knee pain, here, the fifth is depression, and the sixth is obesity. And these patients are usually not considered with high risk of having a bad evolution of coronavirus infection. But this research shows that none of these patients have energy on the chakras. This shows that the immunity of this patient is all compromised independent of their diagnosis. In this slide, the patients were divided per age from 0 to 19, from 20 to 59, and from 60 to 89. It shows the most common diagnosis in Western medicine, from when the patient has energy on the 7th or spiritual chakra, but does not have energy on the another chakras from 1 to 6. They represent almost 70% of the patient study, and in all the groups, the anxiety appears as the one main diagnosis in Western medicine. And the second most common diagnosis is headache in young adults and knee pain in the older patients. It is important to notice that all these diagnoses are not considered high risk for acquiring coronavirus, but it's possible to notice that the majority of the patients with these symptoms have no energy on the chakras, especially when they are in the treatment with high concentrated medication, such as psychotropic and anti-inflammatory medications. And this is established in Arne-Schultz law that I will explain above. And in this table, it is possible to see the same groups and energy results, but showing the diagnosis in traditional Chinese medicine and which one appear more in each group. The teenagers have deficiency of yin and yang, and the young adults have deficiency of yin, and the older patient had more yin deficiency, yin internal heat, and yin and yang deficiency and internal heat. In this slide, it is possible to see the group of patients that had no energy in any of the 7 chakras. Yeah, they have no energy. And they also divided in the same group. And anxiety is a common diagnosis in the 3 groups of patients. And in the young adults, the second diagnosis is low back pain. And in the elderly patient is knee pain, the second most diagnosed. Once again, it is possible to say that these symptoms are not included as high risk for acquiring coronavirus, but even these patients with common diagnosis have no energy on the chakras, showing a weakness in the immunity that would worsen with the use of high concentrated medications, such as anti-inflammatory and psychotropic medications. This slide shows the same group of previous slide, but showing the different diagnoses in traditional Chinese medicine, which lead to the diagnosis of anxiety, low back pain, and knee pain presented on the previous slide. The most common energy imbalances among children and teenagers are deficiency of yin, internal heat, and qi deficiency. In young adults, are deficiency of yin-yang and internal heat. And in the elderly people, it is in the older patient, it's more common in deficiency with formation of internal heat. In this group of patients, you can see that internal heat is common in all three groups. In this group, it's more severe because internal heat generates inflammatory process inside the body, and this is they all have inflammation before acquire coronavirus infection if they have some day of their life. On this graph, the columns is in red represent woman and in blue represents man. The most common diagnosis in women is anxiety, headache, and low back pain, and knee pain. And among men, the most common diagnosis is anxiety too, low back pain, depression, and headaches. This graph shows that a patient with anxiety can have several different energy imbalances. And different imbalances can lead to the same symptom of anxiety. Anxiety is considered the leaf, but the root are the energy imbalances. And the most common imbalances found in patients with anxiety symptoms are yin deficiency, yin yang deficiency, and internal heat. The same can be seen on this slide regarding headaches. Patients with the symptom of headache can have a variety of energy imbalances, leading to the same symptoms of headache. Regarding headaches, the most common found imbalance are yin and yang deficiency or yin and qi deficiency. This graph shows how different energy imbalances can lead to the symptoms of depression. The most commonly found imbalances were yin and yang deficiencies, yin and blood deficiency, and yin yang deficiency with internal heat. This graph demonstrates the different energy imbalances combinations associated with knee pain patients. The most common found imbalance were yin deficiency, yin and yang deficiency, internal heat, and yin and yang and internal heat. In hypertension, let me see. The graph on this slide demonstrates that the different energy imbalances combinations can be linked to low back pain. Among them, the most common are yin deficiency, yin and yang deficiency, and yin and qi deficiency. This graph on this slide shows that different energy imbalances combinations can link it to obesity. The most common deficiencies found are yin deficiency and internal heat, yin and yang deficiencies. And in diabetic patients, the most common imbalances are yin deficiency and internal heat and yin deficiency. As you can see, there are other energy imbalances that may be associated with yin deficiency and heat retention. Several patients with diabetes, they have different energy imbalances. And in hypertension, the most common imbalances is yin deficiency, yin blood and qi deficiencies with internal heat. Now, I will start the third part of this presentation about the comprehension of epidemic and infections in traditional Chinese medicine, and in this case, coronavirus infection. In this study entitled Climate, Environment, and Epidemic Febrile Disease, a View from Chinese Medicine, this author explained the process of viral infection and the energy imbalances associated with it. According to this author, cold, heat, dampness, dryness, and wind are the main external factors related to the seasons. However, when there are abnormal climatic changes, these factors may invade the body. On this study, it is stated that in TCM, epidemic disease are considered to be caused by external pathogenic factor, mainly cold and wind, being called cold damage disorders. After the Qing dynasty, the epidemics were classified as cold damage disorders and warm disorders. In the study, the massive and rapid transmission of the pandemic is related to the cycle of transformation of the 5 elements. Fire to earth, earth to metal, metal to water, water to wood, wood to fire. This movement creates transmission of the external pathogenic factor. In Western medicine, the treatment and prevention of infections is mainly done focusing on the elimination of the pathogen through the use of medication. However, due to bacterial and viral mutation, this treatment may not be always effective. And the treatment in traditional Chinese medicine based on syndrome differentiation. And the treatment with TCM for infectious disease has several advantages. In TCM, everything that comes from the external world, not being related to the internal energies, is called external pathogenic factors. And coronavirus will be considered an external pathogenic factor invasion. Identify the etiology of the disease, the location, the influence of the external pathogenic factors, and the health of the qi. It is important during treatment. This is why coronavirus infection symptoms and manifestation will vary according to the different locations of the world, the different diet, the lifestyle, as well as the specific energy imbalances of each patient. Because each patient may have a different energy imbalances, even though having the same diagnosis in Western medicine as previously demonstrated. In the case of coronavirus, a viral infection, according to traditional Chinese medicine, there will be 3 states of evolution of the invasion of the external pathogenic factor in the body. The first stage corresponds to the invasion of external pathogenic factor itself. The patient may present the following symptoms: fever, mild cold, and dry cough with left button, accompanied by headache, body pain, dry pharynx. And in TCM, it's common to use Chinese herbs for expelling the external pathogenic factor in this stage to prevent the evolution for the 2 following stages. I usually make treatment in this stage without the necessity of using the Chinese herbs because they are hard to find in Brazil. I found tools in Chinese dietary counseling, acupuncture, and homeopathy medications which have the same action of the Chinese herbs would have. And I will explain the necessity of using high diluted medication instead of other types of medication in these kinds of patients. In this first phase, the intention of the TCM physician is to try to expel these external pathogenic factors, staying inside, not taking wind and cold, avoiding to drink cold beverages, and avoid to eat food with cold energy. Avoid to open fridge or walk barefoot because this will worsen the entrance of the external pathogenic factors on the body. And consume boiled and grilled food and drink warm or lukewarm water to eliminate the pathogenic factors through transpiration. The recommendation of garlic tea is also recommended at this phase as garlic has hot energy and may help to eliminate the pathogenic factor as well. And it is also important to change to dry cloths after transpiring, as the wet clothing may create the invasion of more external pathogenic factors. When the patient is hospitalized, it is important to be careful with the external pathogenic factors. Many times, the hospital environment is very cold, what may influence and worsen the evolution of the patient. And this evolution could happen not because of the action of the pathogen, but because of the external pathogenic factors are not being controlled, as Western medicine does not comprehend the external pathogenic factors as a cause of disease when treating the patient. And it's the second phase. When the first phase was not completely controlled, this external pathogenic factor which invaded the body could be internalized, leading to symptoms such as high fever, reddish complexion, chest pain, cough, thick sputum, and suffocation, abdominal distension, full belly, and constipation. The internalized pathogenic factors lead to heat formation in a patient that could possibly have internal heat, as demonstrated on my previous slides, and the treatment on this phase is usually done for taking out this heat retention. And in Western medicine, the formation of internal heat is characterized by the inflammatory process demonstrated in laboratory exams showed in many studies. In this phase, the first step is to identify the energy imbalances of the patients. For example, the symptoms of shortness of breath. In traditional Chinese medicine, when the shortness of breath is on the inspiration, this means a deficiency of the kidney energy meridian that has to be treated. And when the difficulty is on the expiration, this means a deficiency of the heart meridian that has to be treated. The heart is the third chakra, and the kidney is the second chakra that you saw that is the patient have no energy on the majority of the patient. One of the possible tools of treatment on this case is to give the proper amount of water to the patient through drinking water or intravenous way. Proper hydration can improve the shortness of breath, and it can be related to the energy of kidney meridian. And the medication to improve the energy of these organs that are weak, I will explain later. Another common symptom of internal heat is abnormal abdominal pain that may simulate an acute abdomen, leading to an urgent surgery when the actual reason is the internal heat that the patient already had that worsened with the internalization of the external pathogenic factor. In this phase, the laboratory exams may also appear altered with inflammations alterations. And when there is internal heat, the patient may present symptoms of extreme thirst and itching and red marks on the skin, besides bleeding gums as the water on the body is being consumed by the internal heat. In order to diminish the internal heat formation, the patient has to be oriented to avoid the consumption of dairy products, especially melted cheese, chocolate, honey, fried food, eggs, alcoholic beverages, and coconut. In this phase, to not form more internal heat, it is important for the physician to know that all the medications in high concentrations will cause a drop on the vital energy. In patients that already have weak energy, will create more internal heat, creating worsening on the inflammatory patterns on the exam, making the physician to think that is the virus that is causing this inflammation. But the real cause is the use of medication that is worsening the energy. And the clinical manifestation and outcomes that can be different according to the treatment based on different stress reactions. This means that depending on the type of medication that the patient receives, the body of the patient will respond differently, causing different outcomes depending on the answers of the organ to the treatment, considering the invasion of the external pathogenic factor and the treatment the patient is receiving. The patient also has to be oriented to not consume foods that damage the energy of spleen meridian or the fifth chakra. This meridian is responsible for the nutrient absorption, and when imbalanced, the nutrients are not properly absorbed, weakening the body. And this food would be dairy products, raw food, sweets, and cold water, among other drinks. To not imbalance the kidney meridian or the second chakra, this patient also has to be oriented to avoid soda, coffee, and mate tea. And to not imbalance the lung meridian or the fourth chakra, the patient are recommend to eat foods with flowers, such as broccoli and cauliflower. Hippocrates has another quote in which he says, make your food your medicine and your medicine your food. So nutritional advice can be very helpful, as well as advising the patients regarding the external pathogenic factors. And internal heat can also be taken out with auricular acupuncture with apex ear bloodletting, but as many times the patient is hospitalized and cannot attend to the sessions of acupuncture, the use of high dilute medications to take out this heat retention and to improve the level of energy of the chakras can be used to diminish the level of internal heat and consequently the inflammatory process. As demonstrated on the research, the majority of the patients did not have any energy in any of the 7 chakras, meaning that they probably had internal heat before acquiring coronavirus infection, leading to a more severe inflammation process and more complications. Of course, the research I did in my clinic is just a small sample of the energy level of the small numbers of patients. It is possible that this lack of energy is present on the majority of people in the world. A talk from Thomas Cohen, an MD from the United States, states that coronavirus may be related to 5G. The 5G technology started to be implemented in 2018, but all the electromagnetic waves are believed to harm energy. And it is possible that the 5G are related to the lack of the energy of the chakras on the majority of the population, facilitating the situation that we are in the nowadays. And in the third stage of this infection, the invasion of the external pathogenic factors achieves the 5 massive organs of the 5-element theory, known as Zanfu in TCM. They are heart, spleen, lung, kidney, and liver energy meridians. In this situation, many times renal insufficiency and respiratory insufficiency happens because the patient already had an energy deficiency before acquiring the infection. It is very common, the intravascular coagulation, because the blood to flow inside the vessels also need energy, yin and yang blood. And blood only circulates when there is energy in all the meridians. With the invasion of external factors associated with the type of treatment received by the patient, the energy will worsen more and creating more complications. The ground glass opacity of coronavirus infection of the lung, X-rays of patients with coronavirus infection, related is related to stasis of blood demonstrated in many lung biopsy that is caused in TCM by the lack of energy leading to blood stagnation. And the treatment has to be focused on the rebalancing and replenishing the energy of all the internal massive organs to avoid the complication that these patients are presenting nowadays. And the symptoms in this phase are fever, hotness in the palms and soles, irritability, delirium, skin eruption, and hemorrhage, such as nosebleed and hematemesis. Western medicine considers this phase as the critical stage of infectious disease, and the primary pathologies include coagulation dysfunction and multi-organ failure such as sepsis and systemic inflammatory response syndrome. And the toxicity in traditional Chinese medicine is consistent with endotoxin with respect to pathogenicity, and the heat toxicity syndrome is similar to endotoxemia caused by severe infection. The TCM theory of treatment chosen according to climate, locality, and individual is consistent with the epidemiological characteristics of infectious disease, including epidemic, regional, and seasonal features. Therefore, climate, locality, and individual are crucial factors to estimate the nature of the pathogen and the disease. And due to the variation of different reactions of patients that are in different localities, climate, and seasonal features, the use of Chinese herbs cannot be the same for all patients with the same infection because the result may vary. And different individuals exhibit various TCM syndromes and are infected with the same pathogen. Other studies found that elderly and those with chronic bronchitis, coronary heart disease, and metabolic disease usually present blood stasis syndrome, post-lung infection. And therefore, the pulmonary infection treatment for senile patients with chronic respiratory and cardiovascular disease should involve activating the blood circulation. The blood circulation is associated with the balance of the fifth chakra, and for the blood circulation to occur, yin yang qi blood and the five elements have to be working properly. The kidney energy is responsible for the formation of yin and yang energies. When there is no energy on the kidney or the second chakra, the yin and yang energy will drop and the circulation will be impaired. If the kidney energy deficiency is not properly treated, even with the use of anticoagulant medication, the symptom is being treated but not the cause. As I showed on the research I developed with the patient in my clinic, the majority of the patient presents a very significant deficiency in all the chakras meridians, and that is why patients in the third phase of the external pathogenic factor invasion or the coronavirus infection invasion tend to have more complication because the energy of the organs are all weak. And when the fifth chakra is deficient or the spleen energy meridian, there will be difficulty in absorbing nutrient properly. A properly nutrient absorption is related to production of blood energy and therefore blood circulation. When there is a deficiency in this meridian, nutrients are not properly absorbed and blood energy is not produced. And when blood energy is not produced, there will be a blood deficiency. And blood deficiency associated with yin and yang deficiency will lead to qi deficiency. The fifth chakra will also send energy to the fourth chakra, or the lung energy meridian. And the majority of the patients have a deficiency on the lung meridian too, or the fourth chakra. The lung meridian is responsible for the skin and the hair and the capacity of the properly feeling smells. It is also responsible for the distribution of energy inside the body. When the patient has no energy on the lung meridian, he will be more prompt of acquire respiratory tract infections. And the lack of energy on the lung can make the oxygenation harder many times. This difficulty in oxygenation in patients with coronavirus can be due to the lack of energy on the chakras, beside the other complications already explained. The lung is responsible to pass energy for the kidney. The lung pass energy for the kidney. When there is a lack of the kidney energy, the transmission of energy from the lung to the kidney is blocked, leading to shortness of breath symptoms. In traditional Chinese medicine, the symptom of shortness of breath cannot be related to the lung meridian, but to the energy deficiency in other organs, such as kidney, spleen, heart, and liver. As demonstrated, the majority of patients studied had no energy in any of these organs, and the treatment would be replenish the energy of all these meridians to treat the shortness of breath after taking out the external pathogenic factors. Replenishing the energy of these organs, there will be less formation of internal heat or the inflammatory process, diminishing the inflammation process. The medications creating internal heat also have to be diminished or withdrawn. And the blood stagnation leading to intravascular coagulation on the coronavirus infection patients is also associated with deficiency of the chakra's energy, as each chakra is responsible for the production of yin, yang, qi, and blood energy, and the correction of the chakras would correct these energy imbalances and improving the blood circulation inside the vessels. And the treatment of infectious disease in TCM is not directly against the pathogen, but by improving the body's health qi that might adjust the body's immunity to expel the pathogenic factors. Under the condition of deficiency of energy, when large doses of antibiotics or antiviral drugs against pathogens are not efficient, the early use of tools to tonify qi and nourish yin can enhance the effect of the treatment. The lack of energy cannot be observed in medical laboratory exams due to the fact that disease manifests first on the energy level. In the table on this slide, it is possible to see the progression from health to disease from phase 1 to 5. In phase 1 to 3, there are energy imbalances only, but we don't have any laboratory exams alteration. In the phase 4, there are symptoms and laboratory alterations. In the phase 5, there are symptoms, laboratory alteration, but the cellular is irreversible. The cancer patient is in this phase. Many times the patient have symptoms of coronavirus infection, but the laboratory exams appear normal. He is in the phase 1 to 3. And the patient will only be hospitalized on phase 4 and 5 of the disease. A normal exam does not mean that the patient is not sick, but that the patient is on the phase 1 to 3, when there is no laboratory alterations. In the case of coronavirus, the idea is to treat on the first phase, first 3 phases, when there are symptoms but not altered results on the laboratory exams. When there is alteration on the exam, the patient already has a very severe energy alteration and to revert these alterations may be harder. In this slide, I'm showing the medications that the patient usually receive for treatment of energy imbalances. The crystal-based medications and homeopathy according to constitutional homeopathy of 5 elements based on traditional Chinese medicine. This theory was created by me. It is being published until next week. This publication will be on the internet. You can access next week. And these medications are recommended for the patient before acquiring the infection, such as coronavirus, but can also be used in patients with coronavirus infection after the physician spilled the external pathogenic factor that is cold, wind, etc. It is possible to use this medication to tone the energy of the internal massive organs or the 7 chakras and avoid other complications associated with coronavirus infection. If you use toning the 7 chakra that are lack of energy, it will formate less internal heat. That means more less inflammatory process, less intravascular coagulation, and all the complication of infection will be less or none, and the rate of death will reduce dramatically. These medications are recommended. Okay. According to this law, according to Arne Schultz's law, all drugs in high concentration cause a reduction in vital energy. Here is the use of a high diluted medication and the use of high concentrated medication. When you use high concentrated medication, the vital energy will drop, and we don't want this side effect to cause in this patient, because as I demonstrate, the majority of patients don't have energy in any organ. And if you give a high concentrated medication in this kind of patient, he will worsen more his energy, and he will create more internal heat, and he will create more inflammatory process and more complications. When you give high diluted medication, you will give more energy to the patient. And this kind of patient that has lack of energy in all the massive organ, all the chakras, these are the medication of choice that you need to treat this kind of patients, because they need energy. And it's better to use high diluted medication in this case. And I published a study entitled "Can Hospital Osteomyelitis Be Treated Without the Use of Antibiotics?", in which 2 patients with hospital osteomyelitis were taking antibiotics for the past 2 years with no improvement of their infection. And using TCM reasoning, the antibiotics were withdrawn, and the patient presented great improvement of the symptoms. And in this case, the high concentrated medications such as antibiotics, anti-inflammatory medications have been removed, because according to traditional Chinese medicine, these drugs cause internal heat formation, mainly gallbladder meridian, as well as reducing the vital energy of the patients, worsening or inducing the osteomyelitis symptom. The medication was inducing the disease that you are treating. I also published one article entitled "Why Are Diabetic Patients Still Having Hyperglycemia Despite Diet Regulation, Anti-Glycemic Medication, and Insulin?", published by the International Journal of Diabetes and Metabolic Disorders, demonstrates that diabetes is related to energy imbalances as well, mainly in deficiency and heat retention. And in my experience, all diabetic patients also have lack of energy of the chakras. And the treatment with replenishing of the energy of the chakras, considering the root level of the metaphor of the tree, have shown to treat energy imbalance on this type of patient, reduce the level of glycemia, reduce the need of antiglycemic medication, and reduce the insulin use on this patient, both type 1 and 2 diabetes. I also published one article entitled Energy Alteration as the Underlying Cause of Primary Hypertension, published by ARC Nephrology Journal in December 2019, which also correlates chakras energy deficiency as the possible cause of primary hypertension. And these chakras energy deficiencies are similar to the imbalances presented by the big patients and patients with previous myocardial infarction or cancer patient or any chronic disease. And the treatment of these deficiencies lead to reduction of the use of antihypertensive medication or complete normalization of the arterial pressure with no necessity of medication use. I also published a study entitled The Importance of Correcting Chakras Energy Center Alterations to Prevent Pacemaker Indication, in which I demonstrate that the majority of the patients that are indicated to pacemaker have deficiency on the chakras energy, and the replenishment of these energies will improve the quality of the heart and the other organs that were not working properly due to the lack of energy. I also published a study entitled Energy Alteration Leading to Dyspnea in Patients with Mitral Valve Stenosis. And in this study, it was shown a patient that had mitral valve stenosis performed 2 surgeries and had no improvement of her dyspnea. And with the replenishment of the energy of the chakras, she improved completely. Even though the mitral valve stenosis is an anatomic malformation, the symptom of dyspnea was associated with the lack of energy of the chakras. And the history of the patients can be similar to the situation with coronavirus. Maybe the shortness of breath that the patient are presented are associated with the lack of energy of the chakras that the majority of the patient had, as shown in this study, and not linked to the coronavirus itself. I also published a study entitled The Importance of Correcting Energy Imbalances in the Prevention and Treatment of Myocardial Infarction, in which I demonstrated that patients with myocardial infarction have deficiency of chakras energy, and the replenishment of these energies is important to prevent other myocardial infarctions. This is important on the treatment of coronavirus patients because we are seeing that many patients with symptoms of coronavirus died of myocardial infarction, and it is possible that this myocardial infarction is associated with the lack of energy, as the blood does not circulate properly and lead to blood stagnation and intravascular coagulation in several organs, such as the lung, central nervous system, or on the heart artery, leading to the new myocardial infarction. And I also published a study entitled Chakras Energy Deficiency as the Cause of Chronic Conjunctival Hyperemia, in which I demonstrate that patients with conjunctival hyperemia have deficiency on the chakras, and the hyperemia is the symptom of the formation of internal heat that is created due to the deficiency of the energy in all the chakras. I also published a study entitled The Importance of Correcting Energy Imbalances and Chakras Energy Deficiencies in the Treatment of Patients with Glaucoma, in which I discovered that patients with glaucoma also has deficiency on the chakras energy, and the replenishment of the energy of these chakras leads to a diminution of the intraocular pressure and even its normalization. In this study, glaucoma is comprehended not as a localized disease on the eye, but a systemic disease. I also published a study entitled Can Biomaterial Surgical Implants Influence the Body's Health? In which I observed that all metallic objects inside the body cause a diminution of the energy of the patient. Patients with biomaterial surgical implants on the teeth or other prostheses or piercings can have a reduction on the energy of the chakras as demonstrated in this study. In this study, both patients have biomaterial implants and a deficiency in all the chakras. And I also published a study entitled Chakras and Energy Alterations in Patients with Oligospermia, correlating the small number of sperm with deficiency of the chakras energy. And the patient with oligospermia also have deficiency in all the chakras, but the chakra responsible for reproduction is the second chakra as they are all interconnected. There is a need of treating all the chakras to have better results. I also published a study entitled Chakras Energy Deficiency as the main cause of infertility in women, in which two couples with infertility being treated for many years trying to conceive with Western medicine methods were diagnosed with deficiency of the chakras energy. And the treatment of the chakras energy of the couple with Chinese dietary counseling, auricular acupuncture with apex cirbatilating, a medication to replenish the chakras energy, created a natural pregnancy within the first month of the treatment, without the necessity of making in vitro fertilization. I also published a study entitled The Importance of Treating Energy Imbalance and Chakras Energy Deficiencies in Patients with Chronic Urticaria Reactions, in which I demonstrate that patients with chronic urticaria have complete deficiency of the seven chakras, and the treatment replenishing this lack of energy made the crisis of urticaria diminish or disappear completely. I also published a study entitled Can We Treat Atopic Dermatitis Without Using Corticosteroids, in which I show that patients with atopic dermatitis also have chronic deficiency of energy of all the chakras, and the replenishment of the energy of all the chakras associated with acupuncture and Chinese dietary counseling can present very positive results. I also published a study entitled Why Do Patients Still Have Anxiety Symptoms Despite the Use of Psychotropic Medication, in which I described that patients with anxiety normally have chronic deficiency of energy of the chakras, as states the study done in this presentation. And the use of psychotropic medication leads to a worsening of the energy level, sometimes worsening the anxiety because there is an increase of internal heat formation, and the anxiety in TCM is caused by the internal heat. I also published a study entitled Energy Disturbances in Panic Syndrome and How Can We Treat It in Adolescents, in which it was possible to see that panic syndrome is also associated with the deficiency of the chakras, leading to internal heat formation on the gallbladder meridian, leading to the clinical symptom of panic, and replenishing of the chakras improved symptoms and normalization of the clinical condition. As demonstrated in this study, patients with previous serious illness such as diabetes, hypertension, with cardiovascular disease, anxiety, knee pain, low back pain, etc., may be prompted to have complications on the outcome of coronavirus infection because they already have significant chakras energy deficiencies that may harm the Zen Qi of these patients, further making it easier for the patient to be influenced by the invasion of the external pathogenic factors and the virus, and have little energy reservations to maintain health of the body. As stated by Hippocrates, disease was a natural process, that the signs and symptoms of the disease were caused by the natural reactions of the body to the disease process. As showed on the study presented before, the majority of patients already present a significant energy deficiency of the chakras or the five massive organs meridians before acquiring any disease, in this case, coronavirus. As these energy deficiencies were already present, the invasion of external pathogenic factor is easier. As they invade the body, they consume its remaining chi energy, and because of it, the organs collapse easier, as they are already working with almost no energy, leading to severe evolution of the disease. On the conclusion of my study, I showed that the majority of the patient study has no energy on the chakra center meridians, leading to more propensity to invasion of external pathogenic factor or coronavirus infection. And the treatment of this lack of energy is important before, during, and after this infection to prevent the infection in itself and the complications of the infection during the treatment, and after the infection, to recover the chakra's energy meridians to prevent other infection and disease in the future. And the type of medication used is important to do not harm more the energy of this kind of patient even more. Currently, Western and traditional Chinese medicine are different from most physicians around the world. However, they can be integrated, and in this light, it is possible to see a metaphor of yin and yang as different kinds of medicine was created. And for adequate treatment of coronavirus infection patients, it's important to associate traditional Chinese medicine and Western medicine so the patient can treat the symptom and the root of the problem, which are the energy imbalances. To end the presentation, a few sentences from Hippocrates for us to remember. It is important to consider other scientific gains and traditions within medicine prior to the knowledge we have nowadays. And another important quote, it is far more important to know what sort of a patient has a disease than what sort of disease a patient has. In other words, it is more important to know what kind of patient we have to know that he has coronavirus infection and the treatment is only treating the virus and not the patient itself. The third important quote is first, do not harm. And the last quote is natural forces within us are the true healers of the disease. Thank you for listening to this long presentation. And if you have any doubts, I would be happy to answer. And here there is my email on this slide, and I will feel happy to be contacted and explain any doubts you may have. And if you are physician and you are treating patient with coronavirus infection, and if you would like to have some experience treating the energy point of view of this patient, to have some experience, you can contact me and we can share experience, and I can treat this patient with you together to you to have more chance to have more experience with this kind of treatment. Thank you.
Uh, thanks a lot, Dr. Huang Weiling. That was a very elaborated and point-to-point presentation. You have discussed all the points very clearly, and for a layman also, it's very informative. Actually, everyone can understand that particular presentation very clearly. And there is one of the
Não tô ouvindo. I can't hear you.
participants.
I Oh, no, I can hear you now.
Yeah. The, yeah. The question is, what would be the mental treatment strategy for COVID-19 positive persons who had already diabetic or heart disease or aged or dialysis patients
Yeah,
as well?
the first thing you need to expel the external pathogenic factors, because if the patient has in the first stage, you need to expel the cold and wind, and preventing the patient for entering more wind and cold, closing the windows, the doors, don't walk barefoot, and drinking hot water, and eat more boiled food or grilled food. And if you can drink the garlic tea, the garlic will try to expel this the cold that goes inside the body. That and what is the question? I can't remember the question that you
Yeah,
were.
what would be the mental treatment strategy for COVID-19 positive persons who had already been a diabetic or heart disease
Oh,
or
these are the same. The treatment are the same for all the patients with hypertension, diabetes, and all these disease. The problem is the root, that is the lack of the energy of the chakras, and you need to give energy to these chakras to improve the energy imbalances and the symptoms of hypertension, of glaucoma, of conjunctival hyperemia, diabetes, and more propensity to myocardial infarction or other disease, is to improve this lack of energy in all the chakras, giving high diluted medication instead of high concentrated medication, because high concentrated medication will worsen more the vital energy, and we don't want these side effects in this patient. We want to improve more the energy.
okay.
And in that table, there are five homeopathy medication that I usually use to tone the energy of each massive organ that are in the table. Usually, when the patient are in my clinic, don't have uh, ears is stable. I usually measure the energy and begin the treatment during for a period or for 1 year or more, using the crystal based medication and high diluted medication, but they maintain the use of acupuncture and the Chinese dietary counseling too. Because if you don't orientate the dietary aspect, they will not balance the energy as well. And you need to balance the diets, because if the patient is still eating wrong diet, the food will not absorb adequately in the spleen meridian. It will not form blood, and the energy will be imbalanced too. And all the aspects uh, need to be balanced to have the improvement of the energy.
Okay. And one more question is like if one is undergoing this energy chakras treatment, is there essential to have Western medicine also?
The normal medicine that they are using, the yeah, but in the beginning, you need to use both kind of medication. But when the energy of the patient is improving, the patient will feel that his diabetes will decrease, the glycemia. In the hypertensive patient, the pressure will low, and the necessity of the normal medication can be reduced, or you can withdraw the medication in months of treatment. You don't need to use for a long time. When you improve the energy, the symptoms of the disease will disappear completely. And
Okay.
you can take out the medication after the treatment.
Okay. So in the chakras, if the energy is stabilized and if the energy is empowered, uh, the person's immunity will be increased. Is this correct?
Yeah, very correct. That is why I think the majority of the patient in the world has this kind of lack of energy of the chakra, and the use of these medications that they are using, antiviral medication, other medication to treat the patient, they will have more complication because they already have energy deficiency. That the physician today they don't know about this information. That is why I'm here to tell you that it is important to see the patient and not only the virus.
Exactly. Yes, you're absolutely correct. So, for making this treatment of energy alteration in the chakras, the procedure would be either touch therapy or acupuncture or any other thing. It would be a physical therapy. Am I correct?
Yeah, I usually associate auto therapy that I know because usually the patient in this outbreak, I stopped to work for 2 months in my
Okay.
clinic, and I returned two weeks ago. And in this period, the patient maintained the medication, but they feel that they worse the symptoms, and I feel that the treatment that I was doing using acupuncture associated with the medication they were using was very important to the improvement of their disease and the symptoms. And the use only the medication is not so complete. The complete treatment is using acupuncture, apex ear bloodletting, because with apex ear bloodletting, it's a tool to take out the heat retention, and it is very important tool that I will explain in my other presentation, in others webinars that we will have in the next weeks, because the internal heat is the cause of many diseases that we are treating. Anxiety, panic syndrome, infections, and other many kinds of disease, pain. And we need to take this energy balance to have to the patient improve.
That's great. That's great information. Yeah, so there were no more questions. And so before we winding up the session, I would like to introduce Enliven Archive, an open access and peer reviewed publisher to you, Dr. Hyong Wei Ling. You can consider our journals for your upcoming submissions and upcoming research. And you can
Okay.
also be a part of our journals, and we would be very interested to work forward with you. I'll also send you a detailed proposal about this. And any of the participants are having any queries about this, you can either write me or to the mail given by Dr. Huang Wei Ling. She'll be very much happy to assist you guys. And yeah, even if I receive any queries, I'll just make this happen to you. And I would like to conclude this with a vote of thanks to Dr. Huang Wei Long for her beautiful and very descriptive session. And I would also thank all the participants for taking all the time to attend our webinar. Thank you. Thanks a lot. And I'm ending the session. Yeah. If
Okay,
you
thank
have
you
any
very
queries,
much.
you can do it. Thank you. Thanks a lot, Dr. Huang.
Thank you. See you at the next webinar.
Definitely.
Bye bye.
Bye.